Thanks so much to the organisers for inviting me to come and talk about the BioX-TBI study. So I'm Neil Graham. I'm a clinical research fellow in traumatic brain injury based at Imperial. I'm working in David Sharp's group, and this has been a huge programme of work with collaborators across Europe. So the study is funded primarily by the Horizon 2020 scheme, the ERANET Neuron scheme, and several other funders. And so the aim is to try and answer this central question about how we best measure axonal injury in traumatic brain injury. So there's plenty of evidence to suggest that axonal injury seems to be mechanistically important in the clinical outcome of injury and in some of the neurodegenerative consequences of TBI. But in practical terms, in the clinic, it's very difficult to measure. So the useful thing is that there are several markers available in terms of fluid biomarkers which show promise in measuring axonal damage. So these are things like neurofilament light, a cytoskeletal sort of scaffolding protein, microtubule-associated protein tau, and several other fluid biomarkers which show promise, as well as the more established imaging measures like diffusion tensor imaging. So I suppose the question at high level that we sought to answer with the BioX-TBI study was, what should we test and when is best to take it? So various different markers of axonal damage have different time courses. Are we sure they're measuring axonal injury and not something else? So is it specific to axonal damage? And does it relate to some clinically meaningful problem or outcome, let's say? And so this was set up across 7 different research sites in Europe, and patients after single moderate to severe injury were assessed serially up to a year in total duration. So they'd have blood tests done twice over the first 10 days, and then subacutely, 10 days to 6 weeks, have an MRI and further bloods, and then they'd have further assessments at 6 and 12 months. So that was the core study. So there are about 200 patients who I'm going to show the data from who underwent that assessment. And then there's a really special group in addition of 18 patients who underwent invasive cerebral microdialysis in Lausanne and Ljubljana, which is a technique to sample directly from the damaged white matter, and you can measure these same axonal injury markers from within the brain. So let me answer these questions that I set up in turn then. First of all, the timing of different markers. So we see a big raise in all of the fluid markers of brain injury, but particularly in terms of the axonal injury markers, NFL and tau, you can see that these peak at different times. So tau, like most of the markers, peaked around the first day post-injury and then rapidly fell, whereas neurofilament light came up gradually to peak in the subacute time point around 20 days post-injury. So this provides a unique opportunity to sample patients in the clinical setting, around 10 days to 6 weeks when people might have non-specific symptoms and it's very unclear as to whether there's been an injury or not. Second of all, we show some fantastic evidence of specificity here. So we can compare people who've had traumatic brain injury, so these are the red boxes here, these are the earliest time points, with people who've injured different parts of the body, like orthopedic injuries to the limbs, and we can see these markers such as neurofilament light are much, much higher in patients after head injury versus extracranial injuries. And we can see using the invasive cerebral microdialysis here that levels are 100 times higher within the damaged white matter and brain, and that they correlate beautifully with blood levels of these markers. So we can conclude that these are related to axonal damage within the brain that's related to trauma. And are we sure it's measuring axonal injury? So you can compare the neurofilament light levels with an established measure, such as diffusion tensor imaging FA, and you see a very nice correlation there. A strong correlation between ZFA subacutely and the neurofilament light level. And do they predict something clinically useful? Do they tell us there's use, given that we do show that these show axonal injury? And yes, the neurofilament light level, was pretty much the best predictor of the 12-month GOSI compared with all these different markers. So the recovery at 6 to 12 months was well predicted by neurofilament light. And very interestingly, given the relationship between head injuries and subsequent dementia, your neurofilament light level subacutely around 10 days to 6 weeks after injury predicted your rate of white matter atrophy in the chronic phase, 6 to 12 months post-injury. And interestingly, your tau level predicted your grey matter atrophy early after injury. So in summary, I think this has been a huge collaboration across many centres, and I think it's shown some really fantastic results. I think it shows the very high sensitivity of NFL to axonal damage. I think we show very good brain specificity, which is a new finding with this microanalysis work, which has never before been done, comparing levels in blood with brain. And I think we show that we settle this question about when it's clinically best to be sampled, which is in this subacute time point. So I think this provides a real opportunity for translation to the clinic, and I'm really excited about translating that. So I'd like to thank all of our funders, patients and volunteers, and the very large research team involved in the project, particularly Carl Zimmerman, who's worked very, very closely with me on this project.
Great. Thank you very much, Neil.